talk about muscles of upper limb, particularly muscles of pectoral region. We are going to discuss also the serratus anterior. Let's start. Muscles of pectoral region. What are the muscles present in the pectoral region? Is pectoralis major, pectoralis minor, subclavius, and let us see also about serratus anterior. Now, what is beneath this extensive pectoralis major? We have bones, sternum, clavicle, ribs. In between the ribs, you have intercostal muscles, other muscles, namely pectoralis minor, subclavius, serratus anterior. You have axillary vessels and cords of brachial plexus. So these are the structures beneath pectoralis major. Now, see, this is intertubercular sulcus in the humerus. Now, what is the origin of pectoralis major? It takes origin from medial 2/3 of anterior surface of clavicle, from the manubrium sternum and body of sternum till the 6th costal cartilage. Beneath the 6th costal cartilage, the origin extends to the aponeurosis of external oblique abdominis. The insertion about pectoralis major is important. It inserts as bilaminar tendon to the lateral lip of intertubercular sulcus. See, bilaminar tendon meaning it has two lamina, anterior and posterior lamina. Anterior lamina is this one which takes origin from the clavicle and manubrium sternum, which takes insertion in the lower down of lateral lip. Whereas this posterior lamina takes origin from the body and aponeurosis, and this lower fibers receives insertion at the highest level of lateral lip of intertubercular sulcus. Just remember, fibers from above gets lower insertion, fibers from below gets upper insertion. This lower fibers twists around the rest of the muscle to form the fold called anterior axillary fold. So the posterior lamina forms your anterior axillary fold. When this muscle contracts, your arm moves towards the midline, forming flexion, medial rotation, and adduction of shoulder joint. This is your action of pectoralis major. Next comes pectoralis minor. Again, we're drawing the breastbone sternum with the facets for the articulation of 7 ribs. Clavicle articulates with the manubrium. Beneath the clavicle, you have first rib, second rib at the sternal angle or angle of Lewis. With the help of angle of Lewis, you can count the ribs. And what is between the ribs and the sternum? We have costal cartilages. This costal cartilages helps to attach the ribs with the sternum, and the junction between the cartilage and sternum is sternochondral joint. Between rib and cartilage is costochondral joint. Now this pectoralis minor takes origin from this costochondral joint from 3rd, 4th and 5th ribs, and it moves upwards laterally to get inserted into which process of scapula? Yes, coracoid process of scapula. This coracoid process has 3 muscle attachments: coracobrachialis, short head of biceps, and insertion of pectoralis minor. Where exactly in the coracoid process the pectoralis minor is inserted? Pectoralis minor, you should remember this pectoralis minor is the muscle which divides your axillary artery into 3 parts. Okay, now where exactly in the coracoid process? This pectoralis minor muscle is attached to the upper border and medial surface of coracoid process. Just remember upper border and medial surface of coracoid process. So, what is attached to the first costochondral junction? Yes, you have subclavius muscle which takes origin and gets inserted into the subclavian groove of the clavicle. Now, what is the fascia which extends from this clavicle to the pectoralis muscle called as? We have a fibrous sheath which extends from the clavicle to the pectoralis muscle, and that fascia extending between clavicle and pectoralis is called clavipectoral fascia. To know in detail about clavipectoral fascia, let us draw clavicle at the section of the subclavius attachment. This is clavicle, and below I am drawing the subclavian groove which is in the inferior surface of clavicle. What is attached to the floor of subclavian groove? It is subclavius muscle. Beneath the subclavius you can see we have one more muscle called pectoralis minor. Now you tell me what is attached to the anterior surface of clavicle. Yes, it is our extensive prominent muscle pectoralis major. I hope you understand the orientation of this picture. Now that fascia which extending between the clavicle and pectoralis is our clavipectoral fascia. Just concentrate, the upper end of this clavipectoral fascia splits into two lamina, anterior lamina and posterior lamina, to enclose the subclavius muscle, and below it again splits to enclose pectoralis minor, and it comes laterally to attach to the axillary fascia at the dome of the axilla. This dome of armpit is pulled up because of the suspensory ligament which is clavipectoral fascia. What else we should know about clavipectoral fascia? Yes, structures piercing the clavipectoral fascia. Just remember we have an artery, then we have a vein, then we have nerve, and finally lymphatics. Yes, it is easy to remember. Now what is the artery? It is acromiothoracic vessels. The vein is cephalic vein. The nerve is lateral pectoral nerve. And lymphatics. Lymphatic drainage from the breast to the apical group of axillary lymph nodes. This structure pierces the clavipectoral fascia. Now moving on to the final muscle, serratus anterior. Before that, just know few parts of scapula. This is superior angle of scapula. This is root of the scapula, means root of spinous process. I am drawing the spinous process in dotted lines because we can see this spinous process only in the dorsal surface of scapula. Now this is ventral surface of scapula. Yes, the border near the glenoid cavity is lateral border, and the opposite border is medial border. Serratus anterior, we have 8 digitations. First digitation takes origin from the first strip, gets inserted from the superior angle of scapula to the root of spinous process. Second digitation below the root of spinous process in the medial border of costal surface of scapula. Second and third digitations just beneath the root of spinous process. Rest we have 5 more digitations. Fourth digitation, fifth digitation, sixth, seventh and eighth digitation. All these lower 5 digitation gets inserted into the inferior angle of scapula. Like superior angle, you have inferior angle of scapula. What is the action of the serratus anterior? So it keeps the scapula forwards, pulls the scapula forwards. When the fibers attached to the inferior angle contracts, the glenoid cavity of the scapula rotates upwards. When the scapula rotates upwards, obviously the humerus has to abduct. So the abduction of the shoulder joint beyond 90 degree is mainly by the serratus anterior with the help of one more muscle called trapezius. So abduction of shoulder joint above 90 degree is by trapezius and serratus anterior. You should have some idea about scapulohumeral rhythm. This is mainly important for postgraduate students. What is the scapulohumeral rhythm? So when your scapula rotates upward by 1 degree, the humeral abducts by 2 degree. So this serratus anterior 8 digitations inserted into the medial border of scapula. When the muscle gets paralyzed, you have a condition called winging of scapula. Medial border becomes prominent. That's it. Thank you.